Every year, more than 1 million people from all 50 states and nearly 150 countries come to Mayo Clinic for medical treatment. When they do, they are being treated by more than just the healthcare providers and nurses. The care team concept means that every employee who interacts with a patient plays a vital role in that patient's care. Whether you are currently enrolled in a college program or still considering your career options, Mayo Clinic is an organization where you can achieve your goals and discover career and personal opportunities. At Mayo Clinic, every employee is a valued member of an outstanding healthcare team and part of the Mayo model of care. There are several careers at Mayo that make up the care team, and these include patient appointment coordinator, clinical assistant, medical transcriptionist, and medical secretary. If you have ever been a patient at Mayo Clinic, you have had individuals from all 4 of these careers assist in providing patient care for you, even if you were not aware of it. In the next few minutes, we are going to give you a behind-the-scenes look at each of these careers and outline their part in the care team. The patient appointment coordinator role is the voice of Mayo Clinic. Whether a patient is calling from across town for an appointment to be seen for a sore throat or searching across the world for the latest in cancer treatments, the person answering the call is a patient appointment coordinator, or PAC. It is the role of the PAC to listen to the needs of the patient and to align the patient with the most appropriate department and healthcare provider. The nature of the PAC role sometimes requires a little detective work to fully understand the scope of the patient's needs, as well as the appropriate scheduling area. Once an appointment has been scheduled, the PAC offers education to the patient about traveling to Mayo Clinic, as well as instructions on how to prepare for the visit. Above all, the PAC is there to offer a supportive, empathetic voice to the patient. The clinical assistant provides valuable assistance to patients when they arrive for their appointments. This starts at the check-in desk, where the clinical assistant, or CA, will welcome the patient and verify everything is in order for the appointment. The CA will escort the patient from the lobby to the exam room, and in some cases will need to measure the patient's vital signs. They might also review current and past medical information and enter it into the electronic medical record, or EMR. After the exam is concluded, the CA will review and schedule any additional tests or appointments which are ordered by the care provider and create a new itinerary for the patient. A CA's role is one that is fast-paced and they are always on the move. Just like the patient appointment coordinator, a clinical assistant's main role is to provide world-class customer service to the patient in a supportive, empathetic manner. After the patient's visit is complete, the documentation of the patient's visit must be recorded, and that is where the medical transcriptionist comes into the picture. The patient's healthcare provider dictates notes detailing the patient's medical history, current condition, and care plan. The medical transcriptionist transcribes this information into an electronic document called a clinical note. This note becomes a permanent part of the patient's EMR. The medical transcriptionist supports the healthcare provider by interpreting and transcribing the patient's assessment and workup, the surgical, radiologic, and therapeutic procedures, and finally the patient's clinical course, diagnosis, prognosis, and expected follow-up. Medical transcriptionists must have the ability to understand diverse accents and dialects and varying dictation styles because their goal is to provide the patient and healthcare provider with an accurate and thorough documentation of the patient's visit. The last career we will be covering is that of the medical secretary. After the patient's clinical note has been entered into the EMR, the medical secretary works with the healthcare provider to create a letter to the patient's referring or hometown physician. This letter provides information to the home physician for the patient's continued care. Once the letter has been sent, the medical secretary completes the patient's episode of care, which means the medical secretary is verifying that all parts of the patient's visit is complete and no detail has been missed. The medical secretary works in a fast-paced environment where the goal is to optimize the healthcare provider's time and resources by performing a variety of tasks so the healthcare provider's time is focused on seeing patients. Each of these careers plays a vital part in patient care and is essential to the mission of Mayo Clinic. Our goal is that all patients who come to Mayo Clinic feel special and important from the time they phone Mayo Clinic for an appointment until the time they receive their summary letter from their healthcare provider. It takes a team of skilled, dedicated, and caring employees to make this happen.